नमस्ते, मैं प्रणव दास हूँ। मैं आयुर्वेदिक एंड योगा थेरापिस्ट फॉर द फ्यूजन डिपार्टमेंट गुनम हॉस्पिटल। सो मैं इनको को आज जानो बस्ती दूंगा। जानो बस्ती जानो मीन्स नी जॉइंट। ये बनाता है व्हीट पाउडर से बेसन से ना। ये रोटी जैसे बनाता है ऐसे यहाँ पे लगाना है और जो पूरा सर्कल बना के नी का ऊपर जो नी में जो यह जो मुट्ठी है, ये कहते हैं मुट्ठी, यहाँ पे लगाते हैं। लगाने के बाद ये जो गैप है, गैप को पूरा क्लोज करना है। क्लोज करने के बाद ऑयल को थोड़ा गर्म करना है, ज़्यादा गर्म नहीं है, थोड़ा लाइट गर्म है। जैसे इनका ये फील रिलैक्स, ये जैसे आराम कर सकते हैं। तो इनका गर्म होने के बाद थोड़ा चेक करना है, ऐसे करके चेक करने के बाद थोड़ा फास्ट ऐसे चेक करना है। आपका हैंड का ऊपर चेक करने का जो फील, और जो आप ज़्यादा गर्म फील करेंगे तो थोड़ा कम करना है। कम करने के बाद आप जो फील करेंगे थोड़ा ज़्यादा गर्म भी नहीं है, ज़्यादा ठंडा भी नहीं है, उसके बाद आपको यहाँ पे अप्लाई कर सकते हैं। जैसे मैं देखा रहा हूँ,
Department of Fusion Integrated Healthcare, Gunam Hospital, room number 302, third floor, Gunam Hospital, Hosur. Hereby, it's an idea from our side to introduce and integrate different forms of alternative therapies in one super specialty unit of Gunam Hospital. So today we are introducing a concept of rejuvenation of local areas, local joints. So this concept is called as drshashikantsk, wherein you use herbal medications and ingredients to refresh or rejuvenate different parts of the body. Especially sometimes here what we are using is to rejuvenate the joints. So medical point of view, joint is getting rejuvenated. Is it true or not? Let us not worry. But this much is true that a medicated oil can increase the local heat at the areas of the joint, and this heat will penetrate deep into the joint and other surrounding tissue, soft tissues, and it creates a vasodilatation effect, and wherein there is some chemical changes which will happen towards the repair mechanism of the body. So their possible hypothesis is it will kickstart the repair mechanism of the body, and then it will help us to possibly repair those tissues. So this technique is called as a technique, part of a Panchakarma Ayurveda technique. It's called as Janu Basti. Janu means knee, and using medicated oil around the knee in the form of this particular example what we are showing is called as Janu Basti. The temperature of the oil is not more than 40 to 45 degrees, which is tolerable limit for the skin tissues, and our therapist is repeatedly checking the oil's temperatures so that he will not induce any burn onto the patient's joints. With this medicated oil, he will be using cotton dipped in the oil to ease the procedure of Janu Basti. He is using cotton, sterilized cotton dipped into the hot oil so that he can ease pouring of this hot oil onto the knee for Janu Basti.
much.
You can give support. So spillage of oil can be prevented by properly adjusting the wheat dough. You can see our therapist completely poured the oil onto the joint. At least around 200 to 250 ml of oil is being poured, and we let this heat of the oil to go deep into the tissues to give a soothing relief and pain reduction. The oil back. The oil which is temperature is reduced now is taking back to the bowl, and again we heat it to reuse. So Janubasti, we need to do this alternative heating of the tissues around the joint by using the hot oil for 4 to 5 times. Each time waiting for about 10 to 15 minutes for you to take the heat of the oil deep into the tissues. So this definitely helps for a reduction of intensity of pain in any forms of arthritis. Either it may be injury induced or autoimmune induced or osteoarthritis or rheumatoid arthritis. Try not to move. Try not to move.
In the hospital, I'm under
of this wheat dough after the Janubasti.